Hi, so this video is suited to those who have experienced not one but multiple miscarriages, women who are suffering from unexplainable recurrent miscarriage. If your doctor is unable to help you, you don't know what's going on, nobody's giving you an answer, this video is for you. Now, the topic of the day is recurrent miscarriage, which is also the specialization of Antai Hospital. Now, if there's one condition that we can effectively treat for you, is recurrent miscarriage, or RSA. We have spent up to 25 years just solving one problem, which is recurrent miscarriage, and we have understood it very thoroughly. Now, in the global community and medical community in the world, a lot of doctors will say that recurrent miscarriage is still unexplainable because they don't know what's going on. Now, in our 25 years of experience, we've already categorized it according to these four large groups. Now, there are up to 43 individual causes that can lead to your recurrent miscarriage, but they can be categorized into four large groups. The first factor is an immunological factor, which is also our patented discovery of our hospital. Here at Antai Hospital, you can take a look at our patents, look at the clinical data, and also our discovery. You can find out what exactly is causing this immunological factor to be present in your system that is actually repeatedly causing this early miscarriage from happening. And why do I put emphasis in this immunological factor? It's because it's the most common one. A lot of women don't even know that they have this immunological factor. A lot of hospitals don't even provide this diagnosis, but it is provided here at Antai Hospital, and we also provide an effective treatment that is up to 95% successful rate, and also it comes with a full refund guarantee. If you still miscarry after our treatment, we offer you a full refund. So 80%, up to 80% of recurrent miscarriage is all caused by an immunological factor, and we've explained before that how do you develop an immunological factor? Because it's an acquired condition, you're not born with it. So you have to have a history of an induced abortion, you have a history of a miscarriage, you have a history of intercourse during menses, or even natural birth. All of these can cause you to develop an immunological factor. Now, the second factor is an anatomical factor. So what does this mean? It could be something wrong with the uterine morphology. You might have some uterine malformation, septate uterus, naive uterus, other forms of uterine malformation. You might even have an ovarian factor that is causing this recurrent miscarriage, corpus luteum insufficiency, something that's affecting the ovaries. These are all known as anatomical factors, and they only comprise of 10%. Next up is endocrine factors, which means this is the most treatable one, especially those that are causing threatened early miscarriage when you experience bleeding during pregnancy. If it is indeed an endocrine cause factor, which means that the progesterone or estrogen is too low, then you can immediately supplement it to actually prevent this miscarriage. Lastly is a chromosomal one, which means there's a chromosomal abnormality that is leading to this a recurrent miscarriage. Chromosomal abnormality, for now there is still no known treatment because if it is a lethal deformity or chromosomal abnormality, which means the chromosomes actually are so unstable that they actually disintegrate during the first few weeks of pregnancy. There is no known treatment for those, but they are much rarer, of course. And then usually there might be some indications of some genetic components inherited. But what we want to bring in awareness is the most common factor, 80%. If you have a history of a recurrent miscarriage over the same week each time, over 3 to 4 times, 5 times, then it is most likely an immunological factor. If you have a history of induced abortions, then you also stand a risk for developing the immunological factor. Here at Antai Hospital, we offer our anti-immunotherapy, which is patented in over 30 countries in the region of US, China, and Europe. You can take a look at our data. You can take a look at our scientific publications. This has been available over the past 25 years, and our treatment has not failed yet. Just with our anti-immunotherapy, we have already granted several thousands of couples who are unable to get children. When they come to us for treatment, they are able to have successful full-term pregnancies and also a complete family with many children. Now, this is someone If you are also someone that's experiencing this, or if you know someone who's experiencing repeated miscarriages with no answers, please share them this video, let them know that there is hope, that there is treatment. If you have more questions, please leave them down in the comments below, and also do visit the website.